MidCon Anesthesiology Chartered is a group comprised of physicians, nurse anesthetists, and registered nurses who are proud to provide anesthesia services for the obstetric unit of Wesley Medical Center and the Birth Care Center for the last 25 years. And we pride ourselves on being the sole providers of obstetric anesthesia for Wesley Medical Center, who provides services for more babies and moms than in a 16-state region. So, well, if you're like me, I was unable to do natural birthing. The thought of pain is overwhelming, and so obstetrical anesthesia services is basically making moms more comfortable through any means that we can. Our services particularly involve the placement of epidurals for moms who desire one, or the placement of combined spinal epidurals or spinals, which are different types of anesthetic techniques that make moms very comfortable so that they can have vaginal deliveries or cesarean sections. For those moms who are unable to have either one of those procedures, we also offer sedation services and in the way of IV sedation or IV medications to help ease the pain of labor. I always hate it when someone's told, well, it's too late to get an epidural. We will try to accommodate a mom getting an epidural, especially being a mom and having had children. I would never have wanted to have heard, I'm sorry, you can't, it's too late. As long as you can hold still and allow us to safely perform an epidural or a spinal, then it is not too late to have one. So we are available 24 hours a day, 7 days a week. Please, if you want an epidural, give us a call. We'll get in to try to get it done. But if the baby is crowning or you're unable to hold still, that would probably limit you. But just know that we're there in case you need us, or you need a repair, or you have a tear. We're always able then to provide anesthesia through IV medications at that point. So. So many women, especially these days, have a birthing plan. They have a desire. And some women feel let down if they have to have an epidural, or it's suggested that they get an epidural. And our main purpose is to not ever make a mom feel like she let herself down, or her baby down, or her partner down, but that every labor is different. And you may deliver your next baby easily without an epidural, but sometimes an epidural does allow just that. It allows a mom to relax. It allows her to get some rest. We have seen many, many situations where a mom is arrested in labor and has tried and tried and tried through Lamaze techniques, and finally decides to get an epidural, and then is able to just dilate and have that baby very quickly. So each labor is different, and I just tell women, it's like going into battle, going into war. We've never been in war before, right? I haven't.
Right.
And for me to say, no matter what happens to me out there, don't give me morphine if I'm injured, right? I don't want morphine. Well, you've never been injured. You've never been shot. So if you need morphine, maybe when that time comes, you say, you know what, I think I'll take some now. And just know that we're there to give that to you when you need it, and when and if you need it. We're around and available. So the American College of Obstetrics and Gynecology has said that maternal request is sufficient for an epidural. So we are consultants to the obstetrician as anesthesiologists, and so our job is to place an epidural when the obstetrician feels that it is appropriate. So maternal request and obstetrical consent would be the two indications and times that we would come in to place an epidural. Some physicians obstetricians may desire a certain dilation before they would want the epidural placed, and it varies based on the obstetrician. But we are, as consultants, we are happy to come in and provide that service whenever deemed appropriate by the obstetrician. So MidCon Anesthesiology Chartered is comprised of physicians, nurse anesthetists, and registered nurses. And Basically, we provide over about 130 years of combined experience. So we have 5 physicians in the group, with the most experienced having about 20 plus years of experience in obstetric anesthesiology. I'm one of the younger in the group, and I have 10 years experience. So between all of us and between the nurse anesthetist, we have a combined greater than 130 years experience. So we're very well suited to do this job. We love it. We pride ourselves on taking great care of pregnant women. And really, we desire to make this process wonderful for them. We realize this is one of the happiest moments of their lives. We're honored to be a part of it. And it's really a blessing and honor to be able to take care of patients in this time. Obstetrics, or the time of delivering a baby is exciting for everybody. And so, and when it's not so exciting and there are harder times, we're also there to be a sympathetic ear, a calming voice. We're there to help lessen the burden and the pain. So we're just happy to do that. And what we do is we are available 24/7. This is all we do. If you need an epidural, we're there. We're there within 15 minutes, almost always, or shorter. We are available for immediate relief if the epidural stops working or you need an extra bolus or extra medication. We will always be in to evaluate you and get a history and physical on all patients, just so that we are aware you're in our unit and that we are available and capable of helping you in an emergency. So we pride ourselves on being immediately available through our expert personnel. Our nurses will come in and they'll talk to you and they'll get to know you very well. We'll come in and perform the procedures in a timely fashion, and I think we do a great job. We are always evolving. Medicine is an ever-evolving practice. We're always looking to literature and best evidence-based practices. And most recently, MidCon Anesthesia Chartered has piloted the way for an enhanced recovery process for cesarean sections. Our goals in that are to help women recover faster, to help them have more patient or mom-baby bonding, to reduce narcotic or pain medication requirements, and to prevent or reduce nausea and vomiting. It's just the whole perioperative experience is enhanced through the enhanced recovery process. And we have championed that, and we're seeing great progress. We'll be looking at doing a retrospective study to evaluate our progress through that. But so far, patients are overwhelmingly pleased. They're using less pain medications. We're doing additional blocks to help with pain after surgery, and it is going very well. We also try to stay in evidence-based practices with epidurals. So for instance, in the old days, we would do an epidural where we would infuse a continuous stream of medicine, and that medicine would sometimes maybe be too much or too little, but now we have what we call patient-controlled epidurals, and we do different types of techniques where pump delivers medication sporadically, and then the patient also is allowed to give themselves medication through boluses. So that's called patient-controlled epidurals with intermittent bolus techniques. And it's all over the literature, and it's really the best way to provide comfort for the mom without giving them too much. Sure. So when the nurse calls us saying that a patient is ready for her epidural, what the patient can expect is that we will be in within about 15 minutes or less, and we will, the physician or nurse anesthetist at that time will interview the patient and go over their history that has already been obtained, and will discuss any concerns, and then that physician or nurse anesthetist will then explain in detail the risks of the procedure one more time. And so that gives the patient a chance to ask any more questions. And then at that point, that patient will either be sitting up or lying down based on what's more comfortable, the best way to maintain heart tones and things like that during that time frame. And then the epidural takes about 10 minutes to perform from start to finish on average, and it's described in detail. And if they have any specific questions or concerns or can't, the biggest concern is patients like, I can't hold still. What if I move? Will I be paralyzed? I always explain to patients that I think it's a disservice for women to come in with the thought process of being terrified of a needle that they've seen in a class, or being terrified of being paralyzed because that's what they've heard. The reality is that we go well below the spinal cord. An epidural is a technique that is placed below the spinal cord. So there is no risk of injuring the actual spinal cord in healthy patients without diseases that we would know about ahead of time. And we work with you. I mean, if you're in a contraction, we'll stop. We'll stop. We'll let them breathe, let them take their time, get their composure. We'll try to get it in between the next contractions. So we definitely work with the patient. Great. I want the community to understand that MidCon Anesthesiology Chartered is, we are committed to the women of this community and of outlying communities who desire to birth at Wesley Medical Center or the Birthing Center. We are committed to making that experience the best experience of their lives. We are committed to providing up-to-date, evidence-based obstetric care or obstetric anesthesia care. We are the sole providers of anesthesia services for the women's department in Wesley. So if you need an epidural, you're not going to be getting somebody who may do one epidural every month because maybe they're in the main operating room most of the time doing other cases. You're going to get an experienced provider who does only obstetric anesthesia. We pride ourselves on our knowledge, we pride ourselves on our skill, and we pride ourselves on our ability to be there quickly and timely, and to know that when you call for an epidural, we will be there. We'll be there timely, we'll be there professionally, and we are competent and qualified to care for you during that time of your greatest need.